Terry Burke, and I'm from Hermosa, South Dakota. I'd like to make this brief comment before I direct the question to you. For those of you who disagree, and I'm sure I'll bring some booze in this crowd, at least be tolerant. I laid in the foxhole for 1.5 years, World War II, not knowing if I'd see daylight. And I didn't come home to be afraid to get up and stand up and say what I believe. Woo! There are only, and I'm sure you know, Senator, there are only 2 industrial nations on the face of the earth that don't have comprehensive health care. That's us, and hardly anyone else can tell me the other one. The other one is South Africa. Every other industrial nation on this earth has comprehensive health care. You made a comment that you didn't know anybody that couldn't get health care. Well, let me remind you that if you're over the poverty line in this country, which is very low, and too young for Medicare, you may have to sell your house to stay alive. I get excellent care from the government, VA. I think Medicare does a good job. One basic question, what are we going to do? About 47 million Americans that can't afford any health care. What are we going to do about 55 million that are afraid to use what they've got or they'll be canceled or can't get it because they've got a pre-existing condition? My question to you, and then I'll shut up and thank you for your patience. I thank you for this type of meeting. It's one of the few I've been to that free expression is allowed. Why can't the American people have the health care plan you've got? We have that. And thank you for your patience.
Thank you for, first of all, thank you for your service to your country. I would like to see more Americans have the kind of health care plan that federal employees have. I have the same health care plan that the military, the guys at Ellsworth have. I have the same health care plan that anybody who works in federal government has. But it's a choice. The government doesn't pick they don't pick who's going to deliver it. It's not a government-run plan. All these private insurance companies compete for it. I have Blue Cross Blue Shield. That's not a public option. Not even close. I have Blue Cross Blue Shield. They offer my insurance, but I could get Aetna, I could get Kaiser, I could get any number of other types of insurers. It's an open, competitive system, which is why I think, frankly, it works so well. But with regard to your question about the 47 million people who are insured, that's what we ought to be focused on addressing, is making sure that everybody in this country has access to health care. A lot of the issues that you raise, people with pre-existing conditions, people who are worried if they lose their job, they're going to lose their health care, what they call portability, those things can be fixed. But it doesn't take a $2 trillion program and a 1,200-page bill to do that. I mean, these are things can be fixed without having to bankrupt the country and throw everything that's good about the American health system overboard. I mean, granted, we've got problems, and I'm the first to acknowledge we need to reform health care, one of which is cost, and one of which is access for the people that you mentioned. But at the same time, we've got a lot of people in this country who have access to the highest quality of health care, level of quality of health care in the world, and I don't think you have to break that system to fix that problem. And so some of the things that I mentioned, I think would go a long ways toward addressing. I think you can cover everybody in this country. And there's a plan introduced by a couple of my colleagues on our side, Richard Burr and Tom Coburn, that would make sure that everybody in this country has access to health care in the form of a tax credit to go out and buy it. But it doesn't create a government plan to do that. But you raise serious issues. I don't disagree with any of the problems. I just disagree with the solution being a government-run program.